Hi, everyone. Thanks for having me. I'm Dr. Debra Margolis. I am a board-certified family medicine physician. I've been practicing urgent care medicine for the last almost 15 years with a fair amount of occupational health and workers' compensation training. I also do some independent medical examinations with Prime Consulting. So today I'm going to just pull up our screen. Today's topic I was asked to talk about was medical cannabis in the workplace, which is kind of a really interesting topic in a lot of ways, because we're going to talk about, what are, the medical benefits of medical marijuana or cannabis. We're going to talk a little bit about like what is it for screening patients, in pre-employment. What is it about post-injury stuff that we'll look at, as well as looking at what about treatment for those injured employees, and where does medical cannabis fit in? And it's very tricky, as we'll go through, due to the medical and legal issues that are surrounding this topic. All right. So again, the objectives, we're going to talk about medical cannabis, understand the pharmacology, look at different medical conditions and qualifications for patients who might qualify for medical marijuana use, learn the differences between medical, recreational, review state and federal guidelines, and explore the intricacies of cannabis in the workplace, as I mentioned previously. I have no disclosures. I do not own medical marijuana, or do I dispense it? So, all right. So why are we talking about this? Again, American workplaces are facing a lot of presented, oh my goodness, presented challenges. Cannabis is the most frequently used illicit drug. There were some studies that showed 43 million users ages 12 and over. Nearly 18% of adults that are employed full-time and 21% of adults employed part-time admit to using cannabis. I am going to use the terminology cannabis and marijuana kind of interchangeably. In medicine, the medical term is cannabis, but I think it's just a little bit easier to go back and forth with them. Implications of the workplace safety is an issue because about impairment while someone is under the influence of marijuana, and how does this affect overall health and well-being of our employees and workers and public safety. Again, this page just talks a little bit about definitions that we'll be talking about today. Cannabis, again, it's a broad term. It technically means the chemical compound derived from Cannabis sativa or Cannabis indica plant species. Cannabinoids are the biologically active chemicals. THC, or delta-9 tetrahydrocannabidiol, is the main intoxicating component of cannabis, whereas CBD, or as the cannabidiol, is the inactive, non-intoxicating piece of the plant. Hemp is cannabis plant with very low levels of THC. Again, with THC is the more psychoactive ingredient. And then there's, the difference between regulated and unregulated. Regulated means that there is some official body overseeing how it's produced and making sure that there are not a lot of toxins added to it. Whereas the unregulated is probably the stuff that's being sold on the street corner and not regulated. You do need to get certified for physicians and providers to prescribe cannabis. There are certain ways to do that. I'll go through that later. And again, I'm going to use cannabis and marijuana are pretty much interchangeable terms. There's a lot of good slang words for cannabis: weed, pot, reefer, grash, Mary Jane, ganja, dope. You've probably heard a bunch of them. So again, this is the cannabis plant I have a picture of. It's the third most psychoactive substance worldwide after alcohol and tobacco. So basically the dried flowers, leaves, and stems and seeds are used. They're distilled out. You can get the THC part and the CBD part. Again, the THC is the psychoactive part, where the CBD is the non-psychoactive part of it. And there are multiple subspecies and strains that are produced as well. So the pharmacology, just to kind of get a little bit into the weeds of it here, there are two known receptors in the brain, the CB1 and the CB2. One is peripheral and one is central nervous system. So the pharmacokinetics and dynamics of the THC can vary by route. So inhaled cannabis can produce an onset of psychoactive effects pretty quickly, very rapid, with peak effects felt within 15 to 30 minutes and can last up to 4 hours. Versus when you're ingesting the THC, it can take up to from 30 minutes to 3 hours to experience the effects of it. So it has there's different ways of how quickly it affects you based on how the body is taking it in, whether it's inhaling it or eating it. Approximately 2 to 3 milligrams of inhaled THC can produce the effects, whereas the edible or oral, it's usually anywhere between 5 to 20 milligrams. So there's a little bit difference in dosing there. THC, again, which is the active or psychoactive ingredient of cannabis, is lipid soluble. So what that means is that it stays around in the fat cells or the lipid cells, which means it has a very long half-life elimination. And the importance of that is it's hard to detect. It stays in the system for a long time. So even if that individual is tested 2 weeks after ingesting it, there's still some there. It can't tell us if there's an immediate ingestion or not because there's such a long half-life to it. Again, there's many different formulas right now of cannabis. There's tobacco products that you are smoked in joints or blunts or in bongs. It can be vaped using electronic vaporizing devices. It can be mixed into foods or drinks known as edibles. And some people even use the oil concentrates or the resin as well. So the incidence and prevalence, so who's using this and how often? So cannabis was used by an estimated 219 million people worldwide in 2021. In the age group of 12 to 20-year-olds, there was an incidence of cannabis was 6.2% in states without legalized cannabis. And in states where there is legalized cannabis, it was a little bit higher at 7.8%. There was I'm sorry, I just have to move this a little bit. There was nearly 3 million patients who were certified for medical cannabis in 2020. 26 states and the District of Columbia have medical marijuana programs. So how frequent are people using this? So adolescents, again, ages 12 to 17, tend to use cannabis less frequently than the older individuals. So there were some studies shown in surveys done in 2021 that show the average number of days per year. So adolescents, for instance, were using marijuana about 88.9 days in the past year, whereas adults over the age of 17 were using it 148 days in the last year. So there's a lot of people using this. Additionally, in individuals with more than 300 days of use in the last year, which is almost daily for the most part, it was definitely higher in the adults versus the adolescent groups. So there's a couple different things on how cannabis affects a person. It depends on several factors. One, the amount used. Two, the frequency of use. Three, the method of use, whether they're consuming it or smoking it, ingesting it. Experience with it previously. Biology, for instance, some people tend to metabolize it quicker than others, and that's based on your genetics, and whether you're male or female can affect how you're feeling after the use of this product, so to speak. So dosing effects. So this inhaled dose of 2 to 3 milligrams of THC in an ingested dose of 5 to 20 milligrams of THC can impair attention, concentration, short-term memory, and executive function. More adverse effects occur at a dose over 7.5 milligrams per meter squared. And the cannabis intake to achieve a psychoactive effect can result in many adverse effects. There's no definitive set number of, okay, you have this many milligrams of THC is going to cause this immediate effect. It's different in everyone. So clinically, what we see with acute intoxication of THC, again, it's concentration dependent, but physiologically, we'll see signs of tachycardia, so increased heart rate, increased blood pressure, conjunctival injection or the redness of the eyes and dry eyes, dry mouth. Speech can be slurred or slowed. Psychologically, they can have that euphoria and relaxation. They can be sedated. They can have an increased appetite. Neurologically, it can impact their attention, concentration, memory, and associative learning. Undesired effects can be depression, anxiety, perceptual disturbances, and changes in thought content. So you can imagine if someone is, participating in this type of medication or drug, how they're going to be in the workplace. So the most common effects is drowsiness, dizziness, dry mouth, headache, blurred vision, anxiety, nausea, and coughing. Rare effects can be those physiological ones like we talked about, orthostatic hypotension, psychoses and paranoia, severe depression, tachycardia, discoordination, ataxia, diarrhea. And the cognitive effects, this is interesting, improves days to months after stopping. So if someone's a chronic user and they're finding they're having some cognitive effects, there is some evidence that shows that it does get better once they stop using the drug. So I'm just going to throw this in here quickly. We won't spend too much time on it, but cannabis hyperemesis syndrome is basically when people smoke so much marijuana or ingest it that they get this cyclical vomiting syndrome. And since there's been a legalization of medical marijuana and recreational marijuana, especially out in Colorado, where they really first notice this phenomenon, there's been a huge increase in cannabis hyperemesis syndrome. So something to watch for. Really not much treats it when these people come into the emergency room or the urgent care center. We just give them supportive care and pretty much tell them they need to cut back on the cannabis in order for this to go away. There's also a DSM-5 diagnostic criteria for cannabis use disorder. Some people can definitely have an addiction to this. It's usually young adults in the 18 to 25-year-old range. And here's the DSM-5 criteria for that. So cannabis addiction, I just remember people saying, oh, you can't get addicted to it. That is so not true. One study showed approximately 3 in 10 people can get addicted to it. Another study showed that 10% have a likelihood of becoming addicted. And the people at greater risk for becoming addicted are those who are younger and use it more often. So there's regulated and unregulated cannabis. In addition to, regulating chemicals and stuff that are in it, heavy metals, molds, toxins, and stuff like that, the states who have regulated cannabis will monitor those toxins and stuff with it versus unregulated, which can be mixed with anything. In medical cannabis, so for instance, if it's medical marijuana, if you will, the medical cannabis has varying concentrations. They usually try to, each state will have set guidelines as to how much is supposed to be in there. It needs to be labeled. The National Institute of Health, for instance, considers a standard unit of THC to be 5 milligrams. So medical cannabis is a Schedule I substance. And this is the trickiest part of it all, is that in the federal government, cannabis is a Schedule I substance, which means that there is no therapeutic benefits, that it's highly abused and addictive, and it technically cannot be prescribed by physicians. or by anybody. So that's the federal side. And then there's the state side that says, well, they've made it legal for whether it be medical use only or recreational use or both. And so the two are at odds, right? If you think about it, where, federally it's not legal, but on the state level it is. There are 4 FDA-approved medications that are cannabis related, and they're used for different things. And these 4, for instance, Epidiolex is a plant-derived. It's an oral solution. It's used for childhood seizures. Marinol is a synthetic, and it's used for anorexia and wasting syndrome, especially with HIV and AIDS or chemotherapy. Syndrose is another one. It's an oral solution, and it again is for advanced cancer, induced nausea, vomiting, and wasting syndrome. And then there's another one, this last one, Sesamet, which isn't even available in the States, but it's used for chemotherapy related vomiting and stuff as well. So what are clinically, like, is there literally like medical reasons why we would want to use this or prescribe it? So the most studied and the most acceptable medical indications for medical cannabis is chronic pain, muscle spasms, such as patients who have multiple sclerosis, and emotional, psychological trauma, such as PTSD. A lot of studies have been done with veterans and military personnel. Chemotherapy induced nausea, seizure disorders in pediatrics, and palliative care and end-of-life care can help with improving appetite and anxiety. And cachexia or wasting, again, this can help with the appetite and stimulate people to want to eat a little bit more in end-stage cancer and HIV. So as I mentioned earlier, with physicians and providers need to evaluate someone to see if they're a candidate, if they're going to be prescribed medical marijuana. And so you want to do your basic history and physical. You want to see if there's any reasons why it may not be a good idea for them. For instance, are they on chronic opioid therapy? Do they have a substance abuse disorder? Are there contraindications to therapy, et cetera? And then it's a patient and provider contract, much like a pain contract that we have for patients who are under chronic opioids. You want to have a cannabis contract with these people as well. And here's a sample of what it would look like to have that treatment agreement. This is a quick map of the states that have regulated cannabis programs. You'll see the green states, and if you look in our northeast section here, everyone is green except for New Hampshire, and green means that it's adult and medical use regulated program, whereas New Hampshire only has a comprehensive medical program. And I live in New Hampshire, so that's why I'm probably the most familiar with the New Hampshire guidelines and regulations. Okay. As I mentioned earlier, federally, it's a Schedule I drug. There's no accepted medical use according to the federal government. And because of that, you can't write a prescription for a medication that you're technically not allowed to prescribe. So as the way to get around that, the states have said that physicians can write suggestions or recommendations on the usage and not a prescription per se. There is a bill right now in the House. It's been there for almost 2 years now. And what it is trying to get marijuana from a Schedule I to a Schedule III. And therefore it can be monitored and prescribed by physicians. It would make it not illegal for the states as well. So this is just sitting there in the House. Not really sure when this will ever pass. Again, I'm just going to briefly go through the law in New Hampshire only because I'm most familiar with it. There is a therapeutic cannabis program like there is mostly in all of the surrounding states that you're all represented in. the laws basically exempt patients from being criminals for having, medical marijuana with them. They have to have ID cards. They have to be registered. They have to only go to licensed alternative treatment centers. In New Hampshire, for instance, there are 7 of those. They have to be, every state has certain criteria. In New Hampshire, there has to be certain criteria that would make you eligible to have this medical marijuana card, whether it's anxiety, autism disorder is on there, severe chronic pain. It can, and then there's this whole other where you have to have this diagnosis on the left, plus any of these symptoms on the right, and then you can qualify to get your card. So again, providers can only make recommendations. They cannot actually write a prescription. So when a provider makes their recommendations, they're going to recommend the THC to CBD ratio, the route of administration, when to initiate, how to titrate it, and the validation. So how long are they going to be on it, and when is their follow-up going to be? Again, monitoring very closely. So now is kind of we'll talk a little bit about cannabis and work, where work safety, we're going to talk about impairment, and workers' compensation. So again, as we talked a little bit earlier, the workplace cannabis effects are going to cause sedation, disorientation, impaired judgment, slowing of the motor skills, the fine motor skills, delayed decision-making, impaired learning, memory and attention disorder, lack of concentration. I mean, I don't think I want this person driving or, working on the assembly line with equipment and stuff like that. So this is pretty significant impairment that can happen while someone is working. The National Institute on Drug Abuse study among employees who tested positive for marijuana compared to those who tested negative, they found that there were 55% more industrial accidents, there were 85% more injuries, and 75% greater absenteeism among those who tested positive for marijuana than those who tested negative. They were also, not surprisingly, at increased risk of motor vehicle crashes. So the National Security Council's statement is that cannabis impacts psychomotor skills and cognitive ability, and there is no level that is considered safe in the workplace. With that being said, everyone wants more research, more information. The current body of literature doesn't provide a lot of evidence about it. It's hard to do full research studies on a medication that is considered Schedule 1 that you really can't work with under the federal law. So there's not a lot of studies done for that reason. So how do we detect someone who is impaired under the influence of cannabis? It's a big challenge. As I mentioned earlier, it's a lipid-soluble medication, so it's going to stay in the fat cells for quite a while. And the other tricky part is because you can test for it and they may test positive, but it doesn't mean they're acutely impaired. And that's the tricky part with detecting THC or marijuana, is that they can test positive for a while, but it doesn't mean they're acutely impaired. And there really is a lot of different ways to kind of check for impairment, but you can't directly correlate it with they're definitely under the influence of cannabis, unlike alcohol, where we can do an alcohol level and we know that they are certainly impaired at that very moment in time based on the alcohol level. So again, cannabis screening, how do we do it? We use the drug screen method, right? We do urine testing. It detects the THC, not CBD. Again, the complex pharmacodynamics, it makes it really difficult to know if someone's impaired versus if they just have it in their system. Okay. In workers' compensation, we've done a lot with pre-employment evaluation, post-injury screening, and post-injury treatment is what I want to talk about next. So pre-employment evaluations, again, a lot of companies have very specific policies if they're sending us for their pre-employment screening, whether or not they even want to include the THC indicator. A lot of people say, we're going to exclude the THC, just give us everything else but that. They want the amphetamines and the benzos and what have you. And always remember that for Department of Transportation, DOT is a federal program. It's an automatic disqualification when they're doing their DOT exams if they admit or to having any marijuana use. Post-injury screening, again, this is really tricky, as I mentioned earlier, because detection of THC in the urine doesn't always mean they're immediately impaired. So it's hard to do that. So NIOSH is working on exploring different ways to determine impairment in testing that can happen. So post-injury screening, again, can be very tricky. And post-injury care. So this is another interesting kind of avenue to go with. Potential for reimbursement for medical marijuana used to treat work-related injuries. There was some research that suggested that medical marijuana could have a positive impact on workers' health and safety, that some of them could have decreased time out of work and get back to work quicker, have less pain, etc. And there's a lot more research that is needed, but there were some preliminary studies that showed that it actually maybe was beneficial for getting these injured workers back to work sooner. Again, this just talks a little bit about the New Hampshire Supreme Court decision, which talked about workers' compensation insurers may now be held responsible for reimbursing the cost of medical marijuana in New Hampshire. And this is huge because there were some other studies and other states their Supreme Courts then said, well, that can't be because it's still considered federally illegal. So by workers' compensation companies reimbursing for medical marijuana, they're technically breaking the federal law. So it goes back and forth, and there's no clear decision. And that's what this slide talks about, is the great debate, if you will, about how to get it covered, and the legal issues that are surrounding it. And again, it's a state-by-state thing. And this was the big one with the Minnesota Law Review, which said that if workers' comp claims or companies reimbursed it, it would expose them to criminal liability under federal law. So that was a big one. So there's a lot of good debate and questions, and where does medical marijuana come into play in helping our injured workers? Where does it come into play when screening for impairment and the pre-employment piece? I've listed here, I think we have a lot more questions than answers on all of that, but I've listed some references and things that you can kind of look for to kind of help answer some of those questions that you might be wondering about. So that's what I have for today. I'd love to take some of your questions.
There are a few questions in the chat. I don't know if you can hear me. There are a few questions. Dr. David Diamond asks, can you confirm that 25% of all adults have used THC more than 300 days, nearly daily in the last year? I thought your slide showed that statistics. Seems high, no pun intended.
Yeah, let me go back to that slide and I can tell you about it. Hang on.
David, you have a good sense of humor, by the way.
Let me just pull it back up. Yeah, there is an alarming amount of, how often, recreational use of this and which groups are participating, so to speak. Let me just pull up that slide again. Hang on. See if I can share. There we go. Hopefully you can see it now. Share. So if you're looking, can you see the slide?
Yes.
All right. So what it says, so looking at the slide, this was again another study that showed that the question was like, so additionally, the percentage of individuals with more than 300 days in the past year and more than 20 days in the past month for these groups it is alarmingly high, and I like that pun, in adults, but it's like 26% and 48% respectively was on that. And it's hard to know for sure, right? I mean, we do these surveys, but they're not always accurate. Again, it's illegal, so a lot of people aren't going to fess up to what they're doing. But yeah, it is a pretty, adults over 17, definitely it's a higher percentage group. I think that especially where it's more legal in a lot of states and recreationally, you're going to find this probably even getting higher.
Thank you, Deborah. I just want to remind the audience that handouts from this session can be downloaded, and they're in the chat. You'll see that link. Debbie asked if is it not federally approved even for the FDA approval things like under cancer?
Yeah, so there are again, so according the FDA, there's those 4 drugs out there that I mentioned that are either synthetics of cannabinoids that are FDA approved and indicated for cancer treatment, whether it's the nausea and vomiting related to chemotherapy or the wasting and lack of appetite and stuff like that. And those are, like Marinol, et cetera. That Epidiolex is for the pediatric seizures, but there are just those 3 right now that are available in the US that are technically FDA approved.
Is there a way to search what providers are able to write for medical marijuana?
Yeah, there's a registry, I would assume in each state, in which you can look it up and see who'd be able to. There's also having a conversation with your primary care provider or pain management specialist.
And we have
to be certified you have to be certified in New Hampshire to be able to write it. So there are limited doctors. Yeah.
And you can only get it in 7 places.
Correct.
Yeah.
Yep.
Yeah. In Massachusetts, you can get it at every corner. So
yes.
And I've recently traveled through the states, and surprisingly, California didn't have as many medical marijuana stores as I would have thought, because they were pretty high.
Yeah.
Maureen got a question via email.
Okay.
It says, to quote one of the instructors whose training I attended on legal cannabis, just because it's legal doesn't mean you should. This is in reference to those with a license. This may be covered in the webinar, but I thought I would pose this question. It given places of employment that have urine tests as part of the hiring process and ongoing employment assessment. So I wonder if she's meaning, like, even if I had a medical marijuana license, I'm a licensed RN, and for some reason they wanted to do a urine drug test, what would happen there?
Yeah. So that's definitely a good part of it. I mean, so just like any other drug screen we would do, say, for instance, someone is taking Adderall, amphetamine, and it pops up on their drug screen. If we look at their medical history as the MRO and we say, oh, they have this prescribed from their provider, it's legitimate, so to speak. I would think that it would be the same thing with marijuana. Here I have a card, I have a medical indication, I have my provider who gives me the recommendation, and you can kind of backtrack it, then it's okay. With that being said, it is still very company dependent on a lot of, employers and what they're willing to accept or not accept. And
I think those that are working with federal contracts, like
federal, yeah,
the Raytheons, they are not allowing it.
No, federal is it's a Scheduled 1 illegal, no matter what.
I do think, looking at your statistics, if we urine drug test everyone, we would not have many people working. So
yeah. And that's the thing is again, what's like a recreational user, so once on the weekend or what have you, for instance, and then they go to work, a week later and they have an incident and they're drug tested, they're still going to test positive for cannabis, but they're not impaired by cannabis at that moment. And that's the real tricky part of it. In a lot of the drug screens over the last 10 years of the companies that I've worked with, they'd be like, it just, we don't even want to see the cannabis report. Like, don't include it. it's a 7-panel, just give us 6. You know, we don't want to see it for that reason.
Yeah, we're seeing that mostly too.
Yeah.
Does anyone have any other questions? Deborah, this was marvelous. It was really
Thank
well
you.
done. Thank you so much for your time.
Thank you. And please reach out to me if you have any questions at any other time.
Yep.
Thank you all.
Thank you. And I think Maureen or someone's going to get back in and tell us how to leave this program and how to get your CEUs. So please hold on a few more minutes. We're getting lots of thank yous and excellent presentations, by the way.
You all set, Karen?
Oh, I'm sorry. It was me. Ah, so the instructions were that you need to leave through the button at the bottom, the red button. Maureen, then you will obtain the survey to complete, and you will get the CEUs at the credits after that. Am I correct?
Karen, another question came in, Deb, if you're still here. Patty asked, though not necessarily part of the workforce by age, what is it if you're greater than 65 age range use? I'm hearing from other nurses in different disciplines that cannabis use with and without THC is not always asked about or disclosed during various assessments.
Yeah. That's a great point. I see a lot of individuals who are over the age of 65 who will admit to it, or if I ask specifically, they will state it.
They kind of grew up on that Woodstock
Yeah,
era, right?
exactly. Those are our aging hippies, if you will.
Yeah.
But
Yeah.
no, but there's a lot more people out there, I would say, who are using versus who aren't for that reason. There's another question by David Diamond about field test or blood THC levels that might support like acute impairment, I guess is what you're asking about. And there is not at this time. They're working on some other assays and testing and stuff, but at this time there is no field test specifically to determine acute impairment at that moment directly related to cannabis. And then the FDA question, we might have answered this, but the MRO approved the employee if they pop up positive. Again, it depends on if they have that backup for whether it's medically indicated for that individual or they're on any of those 3 drugs that will pop up positive. And also if it has anything to do with a federal agency, it would be no.
Karen Cashel has asked that you restate how we get our CEUs, if you don't mind. And Deborah, thank you again for your time and for educating the nurses. We're very happy to have you.
Thank you.